Welcome back. Finally, there's some good news on the COVID front. Even though new cases are still at an appallingly high level, in the past 7 days, new cases were reported at their lowest rate since early November. The fear, of course, is that the new, more transmissible COVID variants could well cause yet another spike in cases in just a few weeks. And there are very real questions about when schools should and can open. So try to dive into all of these. Joining me now is a man who every viewer knows very well at this point, Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press. Vaccines and schools. Let me start with vaccines. What is the biggest roadblock in the manufacturing process here of these vaccines, in getting vaccines quicker? The distribution problems we are having, I have a feeling, would seem small if we had more supply. What holds us up in having more supply?
Well, it's just that the demand clearly outstrips the supply right now. If you look at the escalation of availability of doses purely on the ability and the capability of manufacturing that, it's going to escalate and will continue to escalate as we go from February to March to April and beyond. So even though there's a clear discrepancy between the demand and the supply, that will get better as we get through February and into March. But that is the limiting factor, Chuck. It's the supply-demand issue. And
is this because, is there any way this moment could have been prevented 6 months ago? Should we have expanded manufacturing capacity and we didn't? Is that why we're here, or was this inevitable?
You know, in some respects, Chuck, with all due respect and fairness, it's a bit inevitable. We certainly, I guess, could have contracted a little bit more aggressively with the companies to get more doses. But right now, this is what we have. These are the contractual arrangements. They're coming off the line as quickly as we can. And as I mentioned, not only will there be more Moderna and Pfizer doses as we get through March and April, but then we're going to be getting J&J or Janssen online. You heard last week about the favorable results, and that's a single-dose vaccine. So things will continue to get better.
Over the next couple of weeks, a lot of folks who have gotten first doses are scheduled to get their second dose. I know you're aware of Dr. Michael Osterholm, who was on last week, and he's an advocate of at least studying this issue of delaying the second dose. We're in a race with these variants, and getting more people immune, obviously with this vaccination, is something a lot of people think would be helpful. Where are you on this? And are we in the middle of studying whether this is a viable option?
Well, you know, one of the things, I understand, Michael and I have spoken about this a fair amount as recently as yesterday. One of the problems, Chuck, is that if you want to really study it to see that, the amount of time that it will take, the amount of people you would have to put into the study, by that time we will already be in the arena of having enough vaccines to go around anyway. So from a theoretical standpoint, it would be nice to know, if you just give one dose, how long the durability lasts and what is the level of effect. But what we have right now and what we must go with is the scientific data that we've accumulated, and it's really very solid. We know that with each of these, it's either 21 days or 28 days. You can do both. You can get as many people in their first dose at the same time as adhering within reason to the timetable of the second dose. So it would be great to have the study, but I don't think we could do it in time, Chuck.
And there's not enough data that's out there now with maybe folks that haven't gotten a second dose, but basically we've created a trial group by accident. There's not enough data out there?
No, Chuck, it doesn't work that way. The N of people, the number of people that have essentially missed that second dose to determine if they are as protected as we showed in the trial, which was 94 to 95% protection when you get it after the second dose. There's not enough people and there's not enough time. It's a reasonable idea. I'm not putting the idea down, but it's very impractical to do. It really is.
All right. Fairfax County Public Schools calls you up today and says, tell us can we open up? What would you say? And if not, how would you tell them to open up?
Well, that's a simple question, but with a complicated answer, because it really depends on the level of infection in the community. The one principle we stand by, and the President Biden has said that, We want to get the schools K-8 open within the next 100 days, all of them. You want to be the first to open, the last to close. What they need is they're going to need some help, and that's why we want the American Rescue Plan, the American Rescue Act, to get through so that the schools can have the capability with masks, with the ability to get better ventilation, all the things you want to do. Of course, vaccination helps, Chuck. It would be great to get all the teachers vaccinated as quickly as we possibly can. That's the reason why they're in the group that is the necessary components of society, namely essential workers.
You set K through 8 as the line here, and I think there's been. Is there more confidence on the elementary school level of the safety versus middle and high school, and that's why we sort of draw a line at 8th grade here?
Well, yeah, it's data. It isn't overwhelming, but it's strongly suggestive. There have been a number of studies to show that when you have children that are a certain age, namely above 8th grade and higher, that they transmit as easily as adults transmit. Whereas younger children, even though they have virus in their nasopharynx when they get infected, they do not transmit as readily. So for that reason, you want to focus on that group, the K-8 group. But there are some data that suggests that.
And finally, let me come back to vaccines and less about the manufacturing and more about the distribution process itself. I've got to read for you a quote from Ann Applebaum in The Atlantic. The people who are getting the vaccine first are the ones in the right health care or hospital groups, the ones who can spend the day clicking links, the ones who are really fast at filling out forms. Anyone without a computer or an internet connection is in big trouble. The result is no more fair or logical than an old-fashioned Moscow queue for cabbage. And Dr. Fauci, my own mother goes to Publix every day to try to figure out how to get into a line, and she can't seem to get one in her state of Florida. It is this weird survival of the fittest. It feels a little Darwinistic.
Well, that's a little bit more dramatically said than I would say it, but there is a kernel of truth, more than just a kernel to that. And there are ways to get around that, Chuck. First of all, the president's plan, the strategic plan, calls for a following. The development and they're lining up and putting into effect community vaccine centers. Number one, getting vaccine to the pharmacies. Number two, getting mobile units to get out into the community, to get it to people who, as Ann Applebaum said, have trouble negotiating a computer or getting things online. That's really very important. The other thing that's important is that we now have an equity task force that is looking specifically at what I think you're referring to. Namely people who, because of a variety of reasons, economic status, where they live, who they are, which have difficulty getting accessibility to vaccines. We are aware of that, and that's the reason why the task force is working hard to eliminate that inequity.
When should our patience run out? In a month, 2 months? You know what I mean? When should we come back to you and say, hey, when are we going to get this fixed?
Well, I mean, Chuck, I can't give you a date. You could always come back to me and put my feet to the fire. I'm not afraid of that, but I can tell you that things are going to get better as we get from February into March into April, because the number of vaccine doses that will be available will increase substantially, in addition to other candidates like the J&J, which will be coming online pretty soon, I believe. All
right. Dr. Anthony Fauci, a man who these days needs no introduction, that's for sure. Appreciate you coming on and sharing your expertise with our viewers. Thank you.
Thank you very much, Chuck. Thanks for having me.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.